Hey, how y'all doing? It's been a while, a long while since I recorded something for you. Uh, and a big reason for that is because I've been, uh, I guess, like many of you, very busy with my job and my routine. For the last 6 months or so, I've been acting, um, if you will, full time as a substance use disorder counselor in a residential um, treatment program for men, um, anywhere from, maxed out is probably about 70 men at a particular time. And I wanted to share some observations for you. Now, this is going to be an important video. It's primarily designed for other counselors and substance use disorder counselors and people in leadership around those issues, behavioral health, but it also is going to have value if you know somebody who's in recovery or should be in recovery, or you're in recovery or in your healing journey, whatever you want to call it. But I'm going to share some observations. Now, I share those observations. I was a substance use disorder counselor, first certified back in the 80s. And then I went off to study some other things in transpersonal psychology. And as many of you know, if you've watched my videos, I've done a lot of different things and spent the last 12 years as a family counselor, working with high risk, high conflict families. So, of course, substance use disorder was always part of that. And so, something that I was always on my radar. Um, but more recently, I've decided to throw my hat back in the ring and address the use of substances. Now, I've done a lot of work over the last 20 years regarding the connection between addiction and indulgence and entitlement, and also that connected to trauma. And if you want to know more about that, check out some of my other videos. But here's where I want to go. When I started 6 months ago at this residential treatment facility, I spent the first month and a half to 2 months observing. And I observed anywhere from 3 to 4 groups a day. Now, when I first started there, I was working 3 days a week. But even then, so that would mean that I was observing about 12 groups, a week. And then I shifted into full time and I began to facilitate and do other things. And I was running as many as 2 to 3 groups a day. And again, with as many as 30, 40 guys in those groups. So I did a lot of observing, a lot of looking at program policy and practice. And, one of the things, there's a lot to say about it, but one of the things that I noticed, for instance, and I want to zero in on today, was that, and again, the residents were there for either 28 or 56 days, 28 days primarily for the SUD, I guess you could say, focus. And if they were concurrent disordered, it was a 56-day stay. And I was assigned to the co-occurring disorders component of the program because I have experience in both of those areas. Um, so, one of the classic things, whether it was 28 or 56, and especially in the 28, the idea was that guys were going to come in and kind of get some traction. Some guys would just say they just came for the clean time, to put distance between them and their use, or them and the streets. But of course, they had to agree to programming. Um, a lot of these individuals who come in are, long-term users in my situation, and fairly impaired, I guess you could say, or their capacity to take in and assimilate information was compromised. That being said, and I say this on the backdrop of another video that I did. I think I was addressing what I call the elephant in the living room, and the elephant, that elephant being spirituality, or what I call the wisdom teachings. There was an absence of it in a lot of different programs, not just SUD, but a lot of different programs across the board. And when we take a look at best practice, or what people call best practice, there seems to be an obvious absence of the use of wisdom teachings and spiritual teachings and spiritual discipline. Although that is woven in, obviously, to the 12-step work that a lot of people do. And a lot of people will even say that, that any real recovery in addiction does contain a spiritual component. That's just a position that people often take. Some people, of course, would debate that. But there's this elephant in the living room, what I call the wisdom teachings, that absence of them. And so my comments then are, I'm watching what's going on in this residential facility, and I'm watching people progress through their 28 days and 56. And the idea was them to get some clean time, some traction, get their medication stabilized, etc. And our clients were attending, again, at least 4 groups a day, and they were also doing a kind of a meditation reflection group in the morning and some things in the evenings. But there was 4 core groups that they attended every day. And these core groups, if you will, 3 of them especially, I guess you could say, and they were only 1 hour in length, which is not very long. And so that's something to take into consideration, because when you only have 1 hour as a facilitator, a group facilitator, to to take attendance, and to do whatever you need to do administratively, you don't even have an hour. At best, you maybe have 45 minutes. Now, if you're dealing with folks who are coming in, out of detox, etc., again, these are, and some of them coming out of incarceration as well. These folks aren't used to showing up on time. Again, they're often physically or psychologically compromised, or their attitude is such that even though they agreed to adhere to the programming, expectations and policy, it's a bit like herding cats sometimes. And so out of the hour that you have, you've not only got to handle all the administrative pieces, but you've also got to deliver something hopefully fairly beneficial. So the way that was done is that there was, I guess you could say, what was considered a best practice curriculum, and there were 3 different curriculums that were being used, one for morning and for midday and for afternoon. But these were what we call work packets or worksheets. And so facilitators would bring in these work packets and worksheets that were educational and academic in nature. You can kind of see the conflict right there, because when individuals, by their history and also by their substance use, are really not in a great place to begin to use frontal lobe, executive function, to be able to understand academic information and assimilate that. That's a challenge in and of itself. But so that was the approach. What was called best practice was using these packets and work packets, and getting through those as much as one possibly could in about 40 minutes. Again, very academic in nature. And this would go on day after day after day. After a while, you'd see you'd see clients, participants, there's some there that are maybe there for the first time. Very rarely, in where I'm working at, is this a first treatment attempt for somebody. Usually they've had 2 or 3 different treatment attempts. And so they're coming in. Some of them had even been to that particular facility more than once. And so they were used to hearing the packet information. If it wasn't exactly the same packets we were using, they had heard the information elsewhere. And one of the things that counselors were often trying to do as participants work their way through the program is to prepare for discharge. And so that means putting together a relapse plan, a recovery and a relapse plan. That meant that a lot of the packets were geared towards identifying triggers, coming up with, cognitive responses to those triggers, dealing with, in our particular situation, we're also using a wellness recovery action plan packet. So we were guiding participants to kind of, again, identify triggers, triggering events, people, places, this kind of stuff. Pretty standard, right? So we'd give all that information, give all that education. And then, as we began to nail down the transition plan, if you will, the relapse prevention plan, the recovery plan, it was about knowing what I call the logistics of where are you going to be housed? What's your residence going to look like? And um, where are you going to attend your first meeting? What does your meeting schedule look like? When are you going to meet with your primary care provider? What about when's your intake for your mental health therapist, your mental health intake? Intensive outpatient treatment, when is your so there were all these steps that were nailed down. And in my case, it was great because we had case managers who worked with these people, and we were primarily doing the substance use disorder counseling or therapy. But a lot of work went into nailing down these steps, these logistics. And yet, what I witnessed is that, and not only what I witnessed, but what I heard participants say was that they've been through all this before. They've been through all these packets before. They've been through treatment before. They had already put together a recovery plan and a relapse prevention plan. They've already been through this process before, nailing down all of the logistics. And, you know, participants would even complain. It's like, gosh, like all you guys do is you just present these packets and you facilitate these packets. And, you know, like it's just not helping me. I've heard all this before. And so, you know, somewhere in there, there has to be a solution. And I began to think about this and, I thought, okay, well, the logistics are like stepping stones. Okay. Stepping stone one, I'm going to have an intake with my intensive outpatient program on such and such a day. And then I'm going to catch a meeting that afternoon at 2 o'clock. But my appointment with my IOP is, at 11 a.m., let's say. So there's whatever, a number of hours between that stepping stone and my next logistical stepping stone. And what I begin to see is that it's almost like guys were falling through the gaps. The step from one stepping stone to the next, there was a gap there, a distance, a separation, if you will. There was time that had to go by or days that had to go by. And in between those logistical steps, they were encountering, I guess you could say triggering events, triggering people, triggering, triggers. And during those periods of time, it's kind of like when they're on their own, they're between the two logistical pieces. What do you think is required? What is required for these participants to be able to fend off, to avoid temptation, to have the clarity of mind and courage and kind of a fluidity, an embodied capacity to be able to fend off those temptations or to address those triggers between the logistical pieces? They weren't getting that. They weren't getting that in the programming. Sure, they were getting, again, some of the logistical pieces, some of the cognitive pieces, they were going through the motions of, of things that they could do to preoccupy themselves between the logistical pieces, talk about self-care. But that was just not strong enough. That was just not significant enough to give them the psychological resiliency that was necessary to really, remain steadfast during those logistical pieces. So what I began to do in my presentations, if you will, as a facilitator, and this is what I've been doing for years and years and years. This is what I was doing as a family counselor when I was facilitating a parent leadership group. I would continually weave together both the academic material and the wisdom teachings and begin to weave those two together. So what I was doing is that I was, I guess you could say, providing, if you will, nourishment and fortification, not just to the mind, not just as an academic piece, but also to the heart, also to the soul and the spirit, weaving both of those two together constantly. Now, how you do that in 40 minutes, you know, can seem like a daunting task, but I can tell you it can be done. But I think it does require not only a willingness, but a passion and a fluidity on the part of the facilitator. But, a couple notes that I have here. So, there's, the education and logistics. That's one piece or two pieces together. So participants get a lot of education and they start to create a plan and put the logistics in place. But what needs to happen next is the wisdom teachings need to show up. And when you talk about wisdom teachings, you really can't talk about it and not talk about relationship. If you notice, a lot of the wisdom teachings are relational in context. You use parables, you use teaching stories, you use Zen koans, but they're always about people interacting with people. That's what I love about the wisdom teachings. That's what I love about spiritual discipline, the spiritual teachings. They're always about relationship. Now, why is that important? Well, as we all know, and some people are very strong advocates in this area, is that there is a strong correlation between, if you will, addiction, whatever, mental health issues, etc. Strong correlation between those things and disrupted attachment. And so coming from an attachment perspective, right, when attachment is disrupted, so if you ever looked at the ACEs information, the adverse childhood experiences body of study, and the assessments that they've developed, that just really, I guess you could, speaks very loudly and very boldly to this connection between trauma, which is disrupted attachment, and the propensity for, you know, uh, all sorts of things, health risks, if you will, not only physically, but psychologically, and also predisposition, if you will, for addiction, etc. Uh, and so there's a lot of research on that. So when facilitators have very little time and the presentations are primarily focused on education and logistics, that wisdom teaching piece and that attachment piece are lost. Or shall we say, at least they become at best kind of like the, second place, if you will. They do not get their due. They do not get a seat at the table, if you will, with the logistics and with the education. But when that is missing, this is, from what I can tell, this is why a lot of times people will not really succeed through treatment, even though they might have attended, the majority of their sessions, and they might have what looks like, a good recovery plan and, a good relapse prevention plan. A lot of that is nailed down and they've got sober housing and these kinds of things. Um, it's only half. That's only half the story. That's only half the remedy. And so, yeah, I began to bring in this whole other idea. And if you looked at some of my other videos, I'm all about integrity. And integrity means to be one with, whole, or undivided. And the question then is, well, one with what? And that's a whole wonderful discussion, big discussion to have. But it really is about developing a connection with, um, some people say, our best self, or some people say our higher self, our true self, whatever you want to call it. That's where the wisdom teachings go. That's where, the, I guess you could say, kind of the glue is developed. It's what holds us together. And there's a lot of different ways to speak on this, but it isn't being spoken enough about participants, in my opinion, are not being introduced to it. It's very simple. A lot of the wisdom teachings are quotes, one-line quotes, or the teaching stories are often very brief, but they're very powerful. And so I really want to suggest to substance use disorder folks and mental health counselor folks, if you're working with concurrent disorders, if you're a leader in this field, if you want to be innovative and create some really good results, then make sure all four of those pieces are in place. You've got, again, the academic component, the logistical component, but you've got the relational component and the wisdom teachings, the spiritual component. Now, again, you could say just two pieces, because a lot of the logistics come out of the education. People are educated on what the logistics are going to look like and be, and what's available to them. And the same thing with the other two, relationship and spirituality, because when you start to take on spirituality and the wisdom teachings, you're gonna also cover the relationship piece. And that's really where, in my opinion, that's where the deep healing is. Um, and and that's where people really recover something incredibly beautiful and powerful about themselves, and something that they can lean into and rely on when things get tough, when they are faced with triggers, temptations, whatever you want to call them. So yeah, that's, I wanted to share this observation with you guys, and I hope it can be something that can be discussed within your own agency, how you do that within your own organization. I'll keep you posted on how I'm doing. I am transitioning between this position and another position with another large organization in another men's residential um, experience, another situation, and I'll be implementing these ideas. And this is supposed to be a innovative project that started. And so I hope to be able to introduce a lot of this information, and as that's happening, I'll keep you posted. Let me know how you're doing and the observations that you're having as well. And I'll keep speaking on different areas around addiction, around programming, around areas of challenge that I see counselors and facilitators run into. Um, and yeah, I look forward to hearing your experiences and your tips and wisdom. So thanks for tuning in.